thank you. This is very exciting for me to be here with you today. And I thank you very much for coming over here to spend a few minutes with us talking about dentistry. It's easy for me to talk about Can everybody hear me okay? All right. It's easy for me to talk about dentistry because this is all I've done in my life. Actually, I completed my doctorate degree in 2003. It's about 11 years. And then from there, I went into more specializing training. And for a lot of people, they don't really quite understand what a prosthodontist does. It's a specialty. It's one of the American Dental Association accredited specialties. You know, you probably more common familiar with the word endodontist or orthodontist, or some people may go to pediatric dentist. So what a prosthodontist does, we pretty much specialize in the adult care in the replacement of missing teeth in every shape or form. So it takes a great deal of understanding how the mechanics of the mouth work to be able to do some of that. So we spent about 3 years beyond dental school to be able to do some predictable prosthetics in the mouth. And so with that, it probably clarifies a little bit of what a prosthodontist is. So there are a few prosthodontists in the country, dental schools. And basically, it takes about a 3-year training. And then we only, every school takes a handful of people. So probably three people per class is what we do. So we don't see a whole lot of those around. But anyways, without further ado, I'm going to get started on some of the topic that I have here. I do have one question, and if anybody has anything of interest or questions, please do not hesitate to interrupt, and I'll stop and probably clarify those for you. I'm here for you and hopefully to be able to answer some of the questions that you may come up with. This is our practice logo, and we're here in town, so I figure I will introduce my team. I'm very fortunate to work with Dr. Craig Head, who's also a prosthodontist and a surgeon, and then a great professional group of people that are there with me every day in the daily operation of our practice. And the reason we're here today is because we do want to create awareness of dental problems and bring the message that a lot of the dentistry that we do is easily preventable and is easily manageable as long as we understand how these problems develop. So maintaining the oral health and achieving a bright smile is the least of our worries. It's basically something that it can be linked to oral health. So it is one body, one system, and when it all works together, combined, then you have a much more predictability for both your body, your oral health, and your quality of life as a whole. A lot of the oral conditions can be transmittable. So if a mother has a baby and the mother has dental conditions or dental problems, it can be transmitted via the oral route to the baby. Same thing with close partners and relationships. You can kiss somebody and you can transmit some of those bugs that live in the mouth. So that's another reason why it's so important to keep the oral health in good shape and up to speed. And ultimately, it affects the entire family. So we go from generation to generation where with everybody's affected because we live in the same group, so we have the same habits. And because it's about habits and breaking some of the habits, they go past generation from generation. So at the end of the day, it affects its quality of life, but it's also affecting you and your family as a whole. Some of the statistics about periodontal disease is that we have about 75% of Americans who have some sort of gum disease or some sort of periodontal problem. It is an autoimmune disease, so if you think in terms of diabetes and some of other autoimmune conditions, rheumatoid arthritis, periodontal disease is classified as an autoimmune disease, and your body has the build and the make to cause some of the problems if it's not kept with good oral hygiene. So you don't really quite cure periodontal disease. You go through periods of exacerbation and remission, so that's why we make it clear to most of our patients to come in on a 90-day routine recall so that we can control and manage it as opposed to cure it. 50% of the Americans do not receive regular oral health care, so that means half of the group here at this point are not getting covered with oral health care in the regular basis. So it's pretty prevalent, and some of the statistics show that 20 million work days are lost due to any type of dental illnesses. So something that can be prevented, and then you don't have to miss work, therefore it doesn't impact on your, your life as far as that goes. But most importantly is periodontal disease, and some of the oral conditions are linked through other type of systemic conditions such as heart disease, diabetes, respiratory problems. So if the mouth is not healthy, and many times we can discover what's going on in the rest of your body just by looking at the mouth. So it's all connected and interrelated. So once again, we're here today to talk about quality of life by raising awareness about your mouth and your oral health. So we have the full body connections where gum disease raises the risk for bronchitis, pneumonia, emphysema, chronic obstructive pulmonary disease, among others. And if we think about how close, and I don't know if you can see, well, the mouth is so close to the heart, and we have a lot of bacteria that have the same affinity that lives in the mouth, in some of the periodontal pockets, travels through the bloodstream, and make its way into the arteries and the heart valves. So that's why it's important for us to talk about how to prevent stroke and coronary heart disease and some of other, by keeping some of those bugs out of the mouth. Diabetes with periodontal disease are also more difficult to control, and a lot of the blood sugar levels are spiked because of some of the bacteria that sits in the mouth as well. So if we think about what medications causes changes, so assuming we have a medical condition that we've been treated for, and your physician, MD, decides to put you on a certain medication, well, those medications now go back and play a role in what's happening with the saliva and the mouth. Therefore, it affects the quality of the saliva, it affects the salivary glands, and therefore, it changes the environment for the teeth to live in a healthy state. Some of the medications that patients take for, like antihypertension, which is some of the most common medications out there, like Norvasac or cardizepine or verapamil, they cause salivary dysfunction along with enlargement of the gingiva. So now we have an altered mucosa caused by the medications that you may be taking for a good reason, and now the mouth does not have the same capacity to defend themselves, and then you have a factor that could make the condition worse. Most patients cannot clean the mouth or the teeth predictably if they have an enlarged mucosa that could be caused by the medication that's been taken for hypertension. So some of those things it requires some assistance from the dental hygienist or the doctor to be able to remove some of that and then get the mouth healthy. Salivary gland dysfunction is the same one of the things about without good salivary flow and without a lubricated mouth, it's very difficult to wear some of the dental appliances, and therefore the teeth suffer. A good fitted prosthesis should have plenty of lubrication and saliva. And when you think about the saliva, it's literally battery water. The mouth is pretty harsh when you think about the extreme temperatures, hot and cold, along with all these different textures in food that we have, peanuts or whatever you call it. So now you're having a lot of things going on, and if the saliva is not there, then we don't have a good response of the teeth and some of the prosthesis. So a lot of patients complain when they come to see us, my prosthesis doesn't work, and then the reason being is something in the system is not quite working well, and that's why it's important to have a maintenance recall so that before it breaks, we can get to it. Taste disorders are also caused by some of the medications, and other infections such as candida or fungal infections are also caused by some of the medications that patients may be taking. The viral infections, some of the herpes viruses around the perioral areas, so some of those are also caused by medications. So here's a list of some of the medications patients are usually taking, and there's a huge number of those that cause dry mouth. Dry mouth causes demineralization of the tooth structure and therefore cavities. And if you have a crown sitting somewhere and you have a dry mouth, now you have a perfect recipe for a fractured tooth. If you're missing a tooth and you have dry mouth with only one restoration functioning, it's an overload, therefore there could be more prone to fracture. And fractures are probably one of the most common dental emergency we see on a daily basis. So here's a list of things that the saliva does for us, and it is a number of things that are important to consider. So if you've been told that you have a dry mouth, there are a number of things that can be done to prevent and correct before the teeth break. The saliva, as I mentioned before, causes remineralization of the teeth because it has some calcium-rich electrolytes that allow the teeth to function well. If the teeth have a crown, then it'll still be in the oral cavity, therefore it'll maintain the functionality of your restorations. The saliva also help with cleansability. So as you're putting more saliva in the mouth, you're able to remove a lot of the things that you eat immediately, right after finish eating. You have to wait in 20 minutes before the mouth gets totally dehydrated and the cavities set in. So if we already have a dry mouth and you want to avoid any other problems, then what we'll do is within the first 20 minutes, we clean the mouth. That way, the teeth get a chance to remineralize. But if you have good saliva, which your dentist will be able to tell you this, then there is nothing to worry about that. Because the saliva helps with the self-cleansing, which everybody has built in. It also buffers and helps with digestion. It lubricates the food and makes any type of prosthesis more comfortable. Does anybody have any questions at this point? Am I going too fast? Okay, good. But then what happens when the saliva is missing? Low saliva can definitely impact, in a negative way, the soft tissues, along with creating some irritants and definitely tooth loss. So improving the saliva quality and quantity improves the oral health. And if, again, the correlation is there with a lot of the medications that cause dry mouth. So this is something to think about. In the lines of quality of life, we definitely have a lot of depression and anxiety from patients who are avoiders or have dental problems. It also causes antisocial behaviors, like you don't want to be around in public or speaking. And it causes weight loss or weight gain as a result of not being able to digest the food properly. And poor self-esteem impedes with speech and communication and also causes some dignity issues. So there is a lot of gain by us maintaining our dentition. So how does cavities, you probably heard these over and over again. It's an opportunity to think about that within the first 20 minutes, if the saliva is not in the mouth or you have a dry mouth, then within those 20 minutes, you can develop a cavity. The idea is to have those cavities addressed within a short period of time before they make its way into the inside of the tooth and then needing a root canal and then a crown. But basically, sticky foods. Now, we will be able to tell whether you have a high, moderate, or low risk for cavities. And it's important for every patient to know that because then your recall appointments are going to be different. If you are high risk, we want to see you about no more than 4 months. But if you have a very low risk, it doesn't need to be a 6-month recall, despite what the insurance will tell you. So it could be a yearly recall, because those patients who didn't develop any cavities early on don't have a risk factor, and therefore some of those guidelines will change. Same thing with most of our patients come and say, do I need x-rays? And that is tied into the high, low, or moderate risk for caries. And everybody's going to be different. Even if it's a family member, it's not going to be the same formula for everybody. It takes some individuality. But if you look at the anatomy of the tooth, you can have cavities that set at the neck of the tooth, and those are the ones that are pretty brutal, because once they set in, it kind of affects right where the tooth is is basically the strength of the tooth, and it breaks the tooth right at the gum line. And then it's all downhill from there because that tooth structure does not recover or repair easily. This is more common in patients who are 40s and up. So we have our patients base is 60s, 40s and up. These would be the ones that we have to be concerned about. Some of the cavities that happen over here are going to be our patients who are under 40s. So most of the kids get cavities at the surface of the tooth. It has to be a perfect recipe for cavities to develop. Basically, we have the time. The time is an important factor. I can't stress enough the 20-minute timeline because that allows that food to sit over the tooth. It also, after 90 days, your flora changes, the bacteria population, so it becomes more aggressive after 90 days. So time is a factor. Then we have a tooth, and when we talk about a tooth, we talk about the person. How is the make of the person designed to be more susceptible or less? And then we have the type of bacteria, which is associated with time. If you have soft plaque, in other words, you brush your teeth in the morning, and then you brush them at lunchtime, and then you brush them at the evening, that's better than doing it once a day. Because the bacteria, throughout the day, within a few hours, changes and grows and gets a little bit more out of control. And then the sugar food, we always talk about sugar because it is kind of the ones that we maybe sip on a candy or chocolate bar, and now we have something that sticks to the tooth and then sits there for a long time. We have some ways of preventing the cavities, and they're pretty easy to use. We have strict recommendations from the American College of Prosthodontists who recommend some mouth rinsings. Depending on the quality of tissue, not everybody will use the same, and not something that's prescribed for the mother can be used for the baby. So it's mouth rinses of different kinds, and we have a lot of products that can prevent some of those cavity lesions. Some of the patients that go at night with a tray, the reason we do that is because it releases, remineralizes, and stays in the mouth all throughout the night. So we have patients who wear that constantly. They're qualified or classified as a high risk, so therefore we protect them that way. And these are the type of cavities that sit on the younger kids, more of your 19 to 20 years old, 25-year-olds. A lot of these cavities we don't see in the older population. Go ahead. So the question is whether the sugar-free gum after a meal provides protection. The answer is yes, it does. It promotes salivary function. It stimulates saliva flow, stimulates the salivary glands, and it helps with your self-cleansability. So your tongue is going to be active, removing some of the food debris that's left. So yes, that is definitely a good question, and is a good habit to get into. Now, some of the questions is, do I do it depending on what appliance I'm wearing? So depending how many teeth you have in your mouth. So depending on how your function is as a result of your skeletal relationship. Some patients have underbites, overbites, cross bites. There's a bunch of things that happen in the mouth that we're not aware of, but it is an important point to bring up. So some patients may temporomandibular joint dysfunction, so if you have a lot of stress in your joint and you're doing a constant chewing, it may not be a good thing from that standpoint. But as far as cavities goes, it would be a positive thing to do. Does that answer the question? Good. All right, so moving on, these are scaling. There are different names for teeth cleaning. We don't like to use the word teeth cleaning. That doesn't quite mean much. There is a prophylaxis. There's also periodontal maintenance. There is full mouth debridement and scaling and root planing. So a lot of different codes and a lot of different language to determine what kind of condition you have. I'm not going to confuse them with that, but basically we scale the teeth to remove some of the calculus that creates some discoloration and irritate the gums to expose the roots. So think about this is all, I guess if it lifts If it stays there for too long, it's going to cause root exposure, and therefore cavities will set in at the root or at the neck of the teeth. So that's why it's important to have a routine scaling of your teeth so that the gum covers the root surface, and then you don't have a risk factor right there. So these right here are calculus, and a lot of patients come in and say, you know, doctor, I did not have a space between my teeth before, but now, as I'm getting older, I'm starting to notice that my teeth are spacing out. What is causing this? So because some of the bacteria has caused some receding gums, the teeth have less support. And that's when we go into the talking about periodontal disease. Periodontal, the gums have a structure that allows your teeth to be stable and strong in a healthy condition. But when you have history of periodontal problems, then the teeth separate and spread out, and then it becomes a braces situation. That's why we see some of our older adults wearing braces nowadays, orthodontics, to be able to put the teeth back into position. So that can be also prevented in the older population. Along with the spacing of these teeth will cause, you know, if you think in terms of a vertical load of a tooth in the long axis, but now it's flare, now you're losing more as you function because you're going to be eating on the tooth. So it gets worse over time. So some of the symptoms of the periodontal disease, you know, something is just not right. It bleeds, it hurts, it's swollen. You know, if it's something that doesn't feel right, then there's something that is not right, despite, you know, you may think, it may go away. Well, no, something is there, definitely there. And so some of the causes, you know, if it's a smoker, for sure there will be a problem. Because the smoking causes some of the, we have some defense cells, and they just don't want to work. They become lazy. And the lazy leukocytes, as a result of some of the smoking products, which I have right here, will definitely set in something that has to do with periodontal compromise. So if you're a smoker, it is for sure something going on within the soft tissues. If it hasn't happened, then it can be prevented so it doesn't happen. So at least that would be a good wake-up call for us to coach you on how to watch for things and maybe encourage you to quit. But oral cancer is another big thing nowadays that we're pushed to talk about as healthcare professionals, especially what we do as prosthodontists. We see most of the older patients. And when it comes to, actually my specialty, that's prosthetics for replacement of resected mandibles, resected jaws. And so we do, whether it's a ridge replacement, ear replacement, any type of prosthetic device that is of a maxillofacial replacement for any type of patients who suffer some of the sequela of cancer. So smoking or risk factors will be alcohol consumption, tobacco use, and any type of irritation or prolonged irritation over your jaws or oral tissues. So some of the things to watch for in the mouth is just like when we do self-exam for any other part of the body. We have patients palpating the head and neck, any type of nodule or changing coloration inside the mouth as well with a light, with one of the flashlights to be able to look at the teeth. And if there's something that doesn't quite look right or feel right, then definitely trigger a consultation. And then we can take care of the right referrals to be able to conduct a biopsy and then treatment as necessary. So like I said before, the reason we're here today is because we definitely want to make sure that you are aware of what can be happening in your mouth, and that dentistry is quite expensive when it comes to repairing. So that's why prevention is the #1 key when it comes to your routine visits. So when we do a lot of the dentistry, we get rid of the bad apple so that all of them don't get bad. So the take-home message is get rid of that bad apple and then keep the rest that are good and juicy. The second thing is repair some of the teeth that need to be taken care of, address them. It'll save you a lot in the long run, because then the more teeth you keep, the more your function is the retention is going to be a lot better, but then the feel for the food and how much you can enjoy every meal is better. And if it needs to be replaced, then that's okay. It needs to be replaced. And what we do is we give you the mobility and the function and the quality of life that you deserve, and treat it like a prosthetic, not like a natural leg. So basically, if you're going to run a marathon, you're probably not going to do it with a prosthesis. I've seen a lot of people that are very good at it, but at least you have a replacement for the teeth that are lost. That way, you can also maintain the quality of life and your function. Talk about a little bit of replacement of teeth. A lot of people question what an implant does. An implant, it can be as a single tooth replacement, or it could be a bridge. And what they do is they are screws that are attached to the bone. They integrate quite well. It takes a number of visits, probably about 6 months to complete it, depending on how much bone is left. One of the most precious things when we talk about dental implants is if a tooth is lost and you have something to anchor it, just like if you want to anchor a nail to a wall to hang a picture, we definitely need to have good foundation. So if anything, if the teeth are lost, don't wait until the bone is lost, because then we really don't have any way of attaching anything. So dental implants have become a significant add-on to cutting-edge dentistry, and it's definitely a good solution for a lot of patients. And that's about it. Yes, sir. Yes. Yes. So correct. So the question is whether you can replace more than one tooth, or even a full maxilla, like 12 teeth with one. So if you had to replace 12 teeth, the minimum there would be 4 implants. That way they need to be placed in a strategic location. That way you can then have a full arch or a horseshoe design prosthesis that will replace more than one implant. So the planning is figuring out what type of prosthesis need to be used in order to replace the function. It can go maybe 2 in the mandible, but we haven't really been done less than 2 on the top. So the bottom, usually you could do it with 2, like you mentioned, but the top is usually no less than 4, in many cases 6. How long does it last? Going back to the maintenance and going back to the principles. If we're gonna fly an airplane, we better know the principles of flying. So we talked about hygiene, we talked about periodontal disease, we talked all things being right and the function being right. We're looking at 28 years 28 to 30 years. It used to be a lifetime, but we're looking at least 28 to 30 years of longevity on periodontal therapy, implant therapy. Yes. Yeah, the question is about the snap-on smile. There are different protocols for prosthesis. When you receive something from a dentist, make sure that you get something in writing where it actually tells you what it's going to do for you. Some of the things will do certain things, and some of them will do different. So snap-on smiles are traditionally done for aesthetics, but that doesn't mean everybody can tolerate them. So aesthetics follows function. Shape follows function. So if something doesn't follow the anatomy of the tooth and is too bulky, then it will probably affect your speech and your phonetics, which is your speech, your tissues that may be a little bit bulky, so therefore you can't really quite swallow. Saliva gets compromised. There's just a number of things that could happen, not on every person. And so if actually one of the things that we do for the people here in the community is to do second opinions And it's worked out very well for a lot of patients, because if you're not quite sure and you need a specialist or somebody that understands this type of prosthesis, then you can definitely find a second opinion before you commit to a treatment. We would like to make it successful for everybody, so I'm sure most dentists in the area do it as well. Yes, sir. Of one implant? Yeah, it's a little bit tough to talk about a specific cost, but it's going to be, I'm going to defer that to Jessica. It depends, like some patients have insurances, and so the price, it's different based on that, and it's also different on what type of prosthesis. So you're going to be anywhere between $1,500 to $6,000, depending on bone grafting, diagnostics, or like I said, if it's just a straightforward 1, 2, 3 replacement, then it's going to be in the low end. Materials make a difference, however. So if you're going to go high noble metals, if we're going to do titanium, ceramics, it changes certain things as well for affordability. One of the things we talk when we talk about price, if you can't afford it once, you certainly cannot afford the remake. So it's best to do it right the first time. Yes, sir. So the question is, what is the recommended over-the-counter products for oral hygiene? Now, there is an individual plan for the most part, and it also has to do with prosthesis in the mouth, so it's tough to generalize to a group like this. For the most part, we're still pushing for fluoridated toothpaste, because it does remineralize the tooth structure. If you have sensitivity to fluoride, then you may not be able to use that solution. Now, there are different concentrations of fluoride within the over-the-counter medication. So I would say if you have sensitive teeth, try to stay away from a lot of the bleaching products, because it's going to make your gums irritated, and also it's going to be very abrasive. If you have grooves on your teeth around the neckline, towards the gum line, you stay away from a lot of the bleaching products that are over the counter. Alcohol products, if you use them on a daily basis, not recommended, because it irritates the cells around the gingiva. So Listerine sounds like a good plan, but not on a daily regimen, because it's quite aggressive because of the content of alcohol. Hope that helps. Any other questions? Yes, sir. The question is whether we do trauma cases, and the answer is yes. That's exactly what we do every day. We do everything that has to do with prosthetics, and a lot of our patients have, unfortunately, had automobile accidents and some other type of traumatic areas to the joints. So that is what we do. We do full mouth reconstruction. We do anywhere, and then we maintain it as well. So, and we work with a lot of the referrals within the area to be able to help them out if you're happy with your dentist and want to continue to have the care. So we're pretty expanded when it comes, and open when it comes to that. We just validate that communication is so important, so that we know what's the plan. Yes. Can you overuse whitening products? If your teeth are yellow, which is the reason why you're using whitening products, it must be because there is lack of enamel, and the dentin or the root of the teeth are exposed. Now, for you to make that call, it's a little bit, it's asking a lot. So we usually don't recommend a whole lot of whitening products over the counter if it's not working for you the first or second time around. So I would use them twice. If it doesn't give you the results, I would stop there. The reason being, something else is missing. The whitening products are meant to work over enamel. And if you don't have enamel, you're doing yourself a disfavor. So twice doesn't work, then I would just consider getting an opinion on what needs to be done to address the color of your teeth. The enamel is part of the ectoderm, and that is a layer of the embryonic development that we don't regenerate. Just like we can't regenerate certain areas of the body, like the bed of a nail, it doesn't regenerate. The enamel will not grow back. The bone will not grow back. So replacement in sense of prosthetic devices such as ceramics is what we've been doing for coverage. Yes, so the question is whether whitening products work on tetracycline stainings. The answer is no. The tetracycline staining is intrinsic discoloration of the enamel. Now, there are different grades of that type of staining. So you have some of our severe cases and some of the lighter cases. Usually that banding is not easily removed by any type of bleaching products because it's part of the build and the make of the tooth. Yes, you can. There are other methods. That's correct. You could do it with ceramics that have a lot more opacity to them, or you could do it with some composites, depending on what we want to achieve. Now, it's always important when we do these things is we take photos to then let the patient tell us what they see wrong with it. Because I may see a lot of things that you see, and you may be seeing things that I can't see. So if we can't communicate about that, then it sure may be difficult to communicate with a lab technician about what needs to be done. So it's important to know, to have a more objective assessment of what you think the problem is, so that then we can fix it, and then hopefully be predictable, because that's the whole key, is to be predictable in what we do. There's not such a bad thing as being discouraged or dentally exhausted when you've gone through a lot of procedures that don't satisfy your initial thoughts. Anybody else? Well, I do want to thank everybody for your attention, and these are great, great questions. I'm very happy to be here, and I will be happy to bring hopefully another topic if they invite me to discuss with you guys. Thank you.